Hi V, I'm very well. How are you doing?
I'm good, thank you.
Okay, that's great. And for anyone listening, hi guys, welcome back to this month's episode of Unapologetically Uterine. And as always, this is a platform where we try to have conversations about women, people with uteruses, anything and everything sexual reproductive health related. We are your one-stop shop for all these conversations. We have a very special topic today because May is like Mother's Month. So we are talking today about gender norms and how these norms influence the perceptions and behaviors people have towards receiving reproductive health care. But just before we get into that, my name is Gail and I am the comms officer for How to Use. Um, and my partner is
Hi, everybody. My name is BNA. I am the new comms officer for Safe to Choose. So I will be taking place of the irreplaceable Cat. I did an episode with Cat before, but this is like my first official episode co-hosting.
I think you do amazing. And yes, unfortunately, for Kat, she's not going to be here anymore. And fortunately for Vianney, I'll be doing this with her from here on out. So, yes, you can still look forward to amazing conversations from both of us. So just jumping right into what we have for today. Um, Vianney, what's your whole take on this today's topic, gender norms and how it influences perceptions about reproductive health care?
So I think the first thing we would like need to discuss is what exactly a gender norm is, and it's anything that society determines or dictates that a person should do or be uh, in line with their gender. So I think when people think of gender, they think of male and female. They think of women and men. But the reality is that there's so many gender identities, and it's not even just like recent. In even in historical, pre-colonial communities, there are genderless people. And I know in Mexico there are genderless people from indigenous communities. I'm not sure, Gail, if in your country there are, but there are in all places. And I think in terms of women and gender norms, it's so difficult because you have to do a lot of things to make sure like you are in line with what they think, especially motherhood. You know, you think of women, you think you might have to be a mother. So I don't know what else you would like to add, Gail.
So I actually agree with that. I think for me in my country, Ghana, I talk about Ghana a lot because sometimes I also feel like personal experiences play a very huge part in how you put things across. So coming to Ghana, there are lots of non-binary people. They do not identify as woman or man. Even though these are like the societal like acceptable genders that have been assigned, and some of these people are as old as, I think not very long ago I saw a documentary on X of a trans woman and one with a non-binary person, and they were in their like 90s, and I was so surprised because considering the climate here about these kind of topics, I didn't think it's something that goes way back. And even when you read a lot about the LGBTQ plus, you can tell that as far back as centuries ago, like even though Africans seem to be very against like the idea that there are more genders than just like man and woman, what we are used to and what we know, it has really been in existence for like a very long time. So I definitely do agree with you, Vianney. um but so just to pick up the conversation, what are some gender norms that you know and that you experience in your daily lives, or even the people around you? What are some of the gender norms that they experience like in their daily lives?
I think one of the most like recognizable one, it has to be in line with like the visuals of somebody. You know, it's like women should have long hair and they should dress accordingly to like feminine stereotypes. Fortunately, I've never been in a circle where I've like been forced to dress or wear whatever. And I know a lot of people that work in offices, for example, like they have to wear heels, they have to wear skirts, they have to wear dresses. Um, Amongst younger girls, it's just like this thing. Either you're a girly girl who loves to wear pink and loves to wear things that are more feminine, or you're a tomboy. So it's kind of classified in these two types of gender norms. And I think with women, it's also a lot to do with their mannerisms, the way they carry themselves. So you can't be authoritative, you can't be strict, you can't be I don't know, things that are more identified to men. So when you're like a woman, you'd be expected to be sweet and motherly and more gentle and nicer. So if you go out of those bounds, then you can't. It's not good for you as a person because you're going against the grain. You're going against what society says that you should be doing. But I think those are like the more stereotypical gender norms that I have noticed in my community. I'm not sure you, Gail. Uh, what gender norms have you noticed in your community?
Sorry, I think yes, I my internet connectivity is acting up a little bit, but I did get some of what she said. So for gender norms, for me personally, I think one thing that really stands out to me is the reproductive role of women as opposed to like the productive role of men. So men men are expected to want to achieve like a higher status in society. They should be leaders in society. They are seen as the breadwinners, like financially they are like the stable gender. And then it comes to women, and then we are assigned with this reproductive role, which is homemaking, childbearing, and just being a supportive partner to your male partner. And also just talking in terms of like a men and women, not not in an effort not to be inclusive, but that's just because that's what's more popular sort of. And they tend to be assigned like all these gender norms, and unfortunately sometimes it sort of spills over into the people who don't want to be like identified as any gender at all, because you see the moment they see a masculine presenting person, oh, then this person needs to conform to the roles that society assigns with a male. If they see a feminine presenting person, then this person is perceived to have to do everything that women are supposed to do in society. These are some of the gender norms that in my daily lives I tend to come across um a lot. V, do you have anything else to add? But I'm assuming you said almost everything you want to. So now we can move on to I'm just wondering. So now that we've spoken about these gender norms, how do you think they influence people's behavior, especially women? How do these gender norms influence women's behavior towards reproductive health?
I think it's something that I've seen a lot. It's gotten better with time, but I feel like a lot of women feel the need to become mothers when they're young. I think there's a point where they reach around 30 years of age and they think, oh no, like if I do not have a child by the time I'm 30, it's going to be too late. I'm going to be too old. And I see a lot of people have children despite not being prepared to have children or something in relation to abortion. Like if you're a woman, if you're about to become a mom, you can't even think about having an abortion. It's not right for the society in terms of the standards. But I think that also pressures women into having children if they're not ready to have children. So in those ways, I think gender norms really reflect into the journey of motherhood. And again, like I'm not a mom, but I've noticed that a lot of moms tend to just have so many not constructive criticisms around their motherhood journey. So anything that they do as a mom will be nitpicked, like, oh, when I was a mom, I did this, or you can't do that, or if you're gonna have a girl, you can't have gender neutral clothing for the girl. It's just little things that for some people might seem unimportant, but the reality is that every little thing does affect the way you work, the way you think, and the way you perceive yourself. So gender norms aren't something that are necessarily good. They could be something you could prescribe to, but I think in general it just limits you, and especially if you are a woman who wants to or doesn't want to become a mother. You don't think about what you want first. You think about what society or your family or your friends or your partner wants for you. What about you, Gil? What do you think?
So I think I had other things planned to say, but this conversation just took me back to a discourse that was on X not so long ago. So someone made a tweet saying that it was around the lines of they really hate seeing women who are poor, like women in poverty, um who give birth to like so many children. And sometimes I think people forget like the nuances of all this because um if a woman is not financially stable, there's a very high possibility that they are dependent on a male provider. And this tends to mean that they cannot, like 90% of the time they do not make like certain decisions. So if she does not have money to even feed herself, then she also automatically does not have money for family planning. And these women have been ingrained by society that as a woman you are supposed to give birth, you should have children, you should have children. So a lot of them actually do not see anything wrong with having so many kids, even if they cannot take care of the kids, because for them they are doing exactly what society expects of them. And if there's a provider in the picture, obviously the provider is also okay with like this woman giving birth to so many kids even though they are not able to take care of them. So that's that. I think that's one way that gender norms influence reproductive health, because these women have been ingrained with the idea that probably the only thing they are good for is like having kids most of the time too, because there's really not like much education, and also zero education about sexual reproductive health and all that. So sort of like they are moving blindly and just do what society expects of them, and putting their health and the wellness of their life at risk in general. So yes, these are some of the ways gender norms can influence people's behaviors towards sexual reproductive health.
I also wanted to add something.
So Vianney, I'm going to. Mhm. Yeah, please go ahead.
What you mentioned is that it's something that stands out to me is that a lot of people advocate for stay-at-home moms, or women who are just stay at home, and that's totally fine. But at the same time, they're not advocating for mental health resources for the women who dedicate themselves to domestic work. They're not advocating for actual like health services or insurance for women who are staying at home or a pension plan. So there are a lot of things that like benefits that you get at a regular job, but domestic labor isn't really thought of as labor. So a lot of the times they don't get these benefits. And like you mentioned, if something happened, they separate, or there is I don't know, maybe cheating in the process, or the spouse passes away, the mother of the woman is left unprotected. So that's very disheartening to know that there's no protections in place for women decide that they or are forced to stay at home, especially if they're forced because of gender norms and because of cultural stereotypes that make women think that they should be in the home.
And just to even come back to your first point, I think that even though there's a gender norm and there are all these rules for women, the expectations for mothers and non-mothers are usually very different. Because I feel like that was the angle we both came from. You came from the expectation of non-mothers, like people who are probably not, they're not old, like in a lot of by a lot of standards they are not old, because I don't think 30 years is old, but people clock 28, 29, 30, and suddenly I need to have a child. Some are like, oh, like maybe at that point they've decided that they are not even ready for like marriage or having like a permanent male figure in their lives, which is totally okay. But for them, as long as they are women, they should have kids. So I'm 30, I should have a child. And it places a very huge responsibility on single women, young single women, because they feel like this is just what is expected of me. So let me just go ahead. And for people who are already mothers, some of them also just end up totally neglecting their health. And for them, it's just, I'm giving birth, I'm doing what my husband wants, I'm doing what my in-laws expect of me, I'm doing what my parents probably expect of me, because I'm married, and as long as I'm married, obviously I have to be giving birth. Just to continue the conversation, um there are some specific gender norms. I know there are lots of gender norms. I don't think we can even list all of them today, but there are a lot of them that are very specific to women and the influence that it has on us making some of the decisions that we do, especially with regards to contraception and abortion. So, Vianney, can you highlight some of the norms that influences the decisions that we as women make when it comes to, oh, should I get contraception, am I going to get an abortion, or am I just giving birth because I'm pregnant?
That's a really great question. I think the first thing that comes into my mind is contraception. You know, if you get pregnant accidentally,
Mm-hmm.
it's 100% your fault, according to society. But the reality is that we
Mm-hmm.
lack a lot of basic sexual health education. So a lot of the times we either don't learn properly about contraception, either from your family or from schools, or we don't learn it at all. So it's your responsibility, but nobody's teaching you this because if you're a woman, you should remain a virgin, or in a lot of societies, they say you should remain pure, which is, you know, um, so it's a burden and it's also a responsibility, but nobody teaches you and nobody shows you. And I think one of the things that also comes into mind is menstruation, like the path to navigating your menstruation and the way your body changes and how you handle it is also very secretive. So in a lot of societies, you're taught that maybe you should be ashamed when you're having your menstruation, and some of them it's more neutral, and some of them it's good. So it depends on who teaches you. For example, my mom, she always taught it to me like it's just like a natural thing. It's something that happens. But even if she didn't say it, like I kind of felt by myself that I had to, you know, if you go to the bathroom, hide your menstrual product and make sure nobody knows that you're on your period and make sure that you're like the most discreet possible. And it's like, no, like half the population has periods. Like it's completely normal. Then why are we hiding this and why are
Yeah.
we not discussing this? In terms of like gender norms towards abortion, again, you know, if somebody has an abortion, it's completely the responsibility and fault of the woman, even though you can't make yourself pregnant. So, like, if you have an abortion, you're wrong. But if a man decides that he wants to have an abortion, then it's totally okay because, you know, it's his decision. It's family choice. So those are the things that I kind of can think of. I don't know about you, Gil. I think you agree with some of them. So could you share some that you can think of?
Yes, I definitely do. The period one especially. So I I briefly spoke to this guy, and one of the things he told me I had to look out for was that he doesn't want me around when I'm on my period. I gagged, like, wait, what? So I he doesn't like it, and he thinks it's not hygienic and it's a woman's thing. So I should always make sure that when I'm on my period, I'm not around him. And it really took me by surprise. And mine is not even like the only story I know. I know a lot of girls who are with people who just frown on the idea of period. Like, don't talk to me about your period. It's a normal thing. Like,
Yeah.
in my head, that's what I'm always thinking. It's so normal. It's happening. What? And it's natural. Very most importantly, it's natural. Why am I being burdened with hiding it? Why should I hide the fact that I'm on my period when, like you said, we probably 80% of the world's population or something are having their period? Maybe 80% is a very large number,
50
but
the
I mean,
population.
you get the picture. I think it's outrageous. um for me, I think one of the norms that really stand out to me is also in relation to abortion, which is more of a cultural and societal norm that abortion is wrong for women, because as a woman, like we've been saying since the beginning of this stream, as a woman, it I don't know, people in society make you feel like you were just put on this on earth to give birth. I know you're on TikTok a lot, but there's currently a trending video of one of the American footballers giving a speech at a graduation, and he was talking about how as a woman you should be homemaking and all that. Honestly, I've not watched the full thing because I just get annoyed from the beginning. But that is the mentality of so many people. And sometimes, unfortunately, even women, there are still a lot of women who think that as a woman, you're supposed to be a homemaker, you're supposed to be giving birth. So a lot of people do not want children, but they also don't go through with an abortion because for them they are doing what society expects of them. It's never about themselves. Like, they neglect themselves to the detriment of society, what society thinks, what their family thinks, what their fiance, their boyfriend, or whoever thinks. But it's never about putting themselves first. And I feel like in doing this, it has also contributed in creating a very negative PR for abortion, because there's so much stigma attached to it that when there are people who even go ahead with it and there are complications and they don't tell anyone about it, they're going to live with it for months or years. So it escalates to something just because they cannot talk about it, because in their heads, um it's coming from a very like religious angle, because sometimes some of the messages I get are like that, like God had a reason for giving me this baby, so I shouldn't have aborted it. That's why some of them regret their decision. So I think for abortion is the cultural and religious norms that are attached to it, and probably same for contraception as well. And but I think for contraception is so heavy on the fact that most women feel like when it comes to these kind of things, they need to decide with their partner. I don't mind discussing certain things with your partner, but I'm a firm believer in it's your body. Like, it's still your body. So if you go tell your partner that, okay, so you think that you want to get on a contraceptive, you want to get on a contraceptive method because you're not ready to have a baby right now, and they say no, then that just I don't know, that just stops you, and you just go ahead with whatever they say. I know it's not as simple as I'm putting it, because like I said, usually when the man is the provider, then it feels like he makes all these big decisions. So it takes away from the women in these situations doing what they actually want, which is probably getting on contraceptive. Yeah. I feel like I've spoken a lot right now,
No,
but
no, no. That's
yeah, this is a very interesting topic. So
it's no, because it actually like it inspires me to think of other things. Because for example, you were talking about
Mhm.
this speech on TikTok about this man who kicks a ball but thinks that women are beneath him. But anyways, on social media, there's also a regression, and a lot of people are very anti-birth control now, which I think you can
Mhm.
discuss some things about birth control, but there is a very like conservative leaning culture that's expanding over social media, and they're pushing back on things that are allowing women to take control of their bodies, including birth control, including abortion, including sexual education. I think it's very interesting that gender norms are like playing into this because we're saying like, oh no, women, we shouldn't have all this access to birth control, but at the same time, they're not advocating for men to have their own birth control. Because as we know, men basically have two options: a condom or a vasectomy, and they are making different types of birth control, but they don't want to let it out into the public until it has zero health effects on men, which says a lot because all birth control have, especially hormonal ones, have effect on women, but there aren't any like studies or pushing back because they're affecting women. So that's also a thing that where gender norm plays into. Birth control, no for men, yes for women, all the responsibility for women, but also women don't let birth control ruin your body and don't use them because it's bad for you. So it's kind of like, what am I supposed to do? Especially as a woman, if you are in social media a lot, you're like, well, what am I supposed to do? What are my options now? I should take care of myself, but everybody's saying birth control is like not great for you. But like my partner doesn't want to use it, and I don't want to. Like it's just so confusing. But you were going to go to another point, Gil. But I think that's just like what I wanted to add. I think you might be muted, Gil.
Oh, hi. Sorry, I was muted. um yeah, I agree. I agree with all the points you added. Now I feel like almost every time I come across a contraception video, it's negatives. It's highlighting like all the things that some of the methods can do to your body as a woman. And I feel like this is also scaring a lot of the women away from making these family planning decisions. So it's a long and hard fight. I should say it's a very long and hard fight. um but how can we challenge these harmful norms that are out there, like whether in society, like within ourselves, in our groups, on social media, like whatever. How can we challenge these harmful norms? I think for me, one thing that really stands out to me is shifting narratives, because there's so much bad PR about contraception. It's so much bad PR when it comes to abortions. So the more we highlight like good stories, the more we highlight just the experiences of other people, the more the rest of the women out there, just the rest of society can also see, okay, so there's also this very good side to this thing that everybody seems to be saying is so negative, especially when it comes to women making reproductive health decisions. So I think I keep stressing on the gender norm of women being child bearers and homemakers, because it's one of the most popular, and also one that does a lot of harm, because I feel like that's one of the reasons why child marriages are even perpetuated, because she's a girl. She doesn't really need to go to school. She does not need education for anything. So you have kids as early as 13 years, Like you have girls 12 years, 11 years being married off to men who can be their grandfathers because that is how some societies see like the value of a girl, of a woman, of a young lady. That's it. That's what you're supposed to be. Be a homemaker, be a child bearer. So I think with the shifts in narratives to media representation should have a lot of roles assigned to women. I think now is better than it used to be, but it's something we shouldn't stop. We should have there should be movies, there should be books, there should be stories, there should be skits about women who are career focused, women who are childless by choice, just women who are living their lives, women who have kids by choice. Women who have kids because they want to, not because that is what society expected of them. So I think, yeah, this is definitely one way that there can be like a shift. And also, like I said in the beginning, highlighting the stories of especially abortion stories so that people can also see that, okay, even though there's so much stigma attached to the topic of abortions, it is happening. Like people are doing it and they are okay. It's a choice they made for themselves. It's a personal decision because they were not ready to be parents yet. And there's nothing wrong with that. So, V, do you have any other thing to add?
I think you gave a very, very complete answer. So I'm going to try to give something that's equally has a great quality. I think you highlighted very well that we need a better education system in regards to sexual and reproductive health. I think a lot of the times people are unaware of things because they just don't understand that it's not right. For example, a lot of people might not even know what a gender norm is. To them, it might be something completely normal, completely regular in their society, so they don't question it. So I think, for example, if you are a girl who's listening to this, no, even a boy, like grab a list, write down things that a boy can do and a boy can't do according to what like society has told you, and then you can compare the list and be like, oh, there are differences, but I feel like I can do what the boys do, or I feel like I can do what the girls do. So, you know, why am I listening to something that does it make sense for me as a person, or does it enrich my life? That's something that I feel like could be very useful. Um, I think we just need to really focus on the inside and see what are our own biases. Because maybe there's something that, oh, I'm very liberal and I'm not conservative. And then something new comes to you and you're like, oh, I don't agree with that. Like you have to question yourself and question what are the gender norms that you prescribe to, even if you battle some of the other ones. And I think just in general, you know, it's very hard to change society as a whole, and it's very unrealistic to expect one person to do it. But one voice does make a change. And even if you're just discussing it with your mom or your grandma or your cousins or your friends, your teacher, maybe your partner, you can see that what you say makes a change. Like I know a lot of people had told me that when they began speaking to me, it completely changed some of the ways they saw things because they had never thought of thinking of it a different way. So to them, something like, I don't know, women are not beneath men. To them, it's just like a whole new idea, a whole new concept that they've never thought of because nobody has ever told them that they can think differently. So I think my main advice would be to think differently. Think of what society tells you should be, and think, why do people think it should be like this? How can I challenge that? How can I change it? What makes me special? What makes me me? And it's okay if you have qualities that are different, that aren't necessarily, for example, feminine, or are in line with what people think a woman should be. But that's it, you know. And like we said, some women may not be mothers, and that's totally okay. Some women may not want to have like children or babies. Maybe you want to be like the cool aunt who's always traveling and just gives a lot of presents to their nieces and nephews. Like that's totally okay. It's your decision because it's your life. And if we live our lives in line with gender norms, I don't think we're ever going to be happy. I don't think we're going to be our true selves. That's what I would say. That are some ways we can challenge the gender norms.
Thank you. I have to thank you because I especially like the point about not being able to change society as a whole because it's unrealistic. But each conversation that you are having with someone can still make a difference. So yeah, I really like that. So as much as you can, try to question things and to have conversations with other people, because you honestly never know what new idea you let somebody else come across. So it's a great thing. um I think educating and creating awareness on these topics is sort of some of the like top ways for us to be able to ensure that these gender norms are not having like so much harm on women's decisions when it comes to sexual and reproductive health. But how do you think that this can be possible? How do we educate people? How do we create awareness on the harm that gender norms are creating? V.
I think something I'm thinking about right now, and we mentioned it in this chat, is sexual education. And in my own example, sexual education was okay, but it really wasn't that great. And what I really like now that I'm older, I would have loved to also know what changes go with boys. Like, I only understood what changes would be with women. I never understood what would happen with boys. I don't understand how their body works. Like, I'm very lacking in that sense. And I know it's like the same. Boys don't understand how the bodies of women work, of girls work, and that's why you encounter men like you shared before who are like, I don't like periods. Don't be around me with on your period. If we equally learn about other types of bodies, I feel like it's better for us because we have a better understanding. And then we can eliminate things like, oh, men are naturally more tough and stronger, and women are naturally weaker, and things like that. When you realize that biology doesn't really have a role in that, then you understand that a lot of the things are just because society dictates that that's what it should be. So that's one of the things I think could help. I also think it's never too late. I think we can learn how to empower ourselves and our bodies as we go, especially as women. Our bodies are constantly changing. Like right now, I'm 26, and the way I feel my body is totally different from when I first started puberty. And it's probably going to be different when I'm in my 30s, when I'm in my 40s, when I'm in during menopause. So I think that I would love to be able to learn as I go and like understand things like, the world doesn't end when you turn 30. Your body doesn't shrivel up and just stop working when you're 30. So it's okay to have children afterwards if you want to have children. And it's okay, for example, to be a mother already and decide that you don't want to have any more children and maybe get an abortion in the future. That's totally okay. So I think those are things that if we realize how our body works, then we have a better control of how we want to live and what we want to do. So, what about you, Gil? What do you think could be added to this advice?
Um, I also think that as we are educating like the people, providers also need to be educated because there's also a lot of bias when it comes to seeking reproductive health services, because I've heard of instances where a woman will probably go to, so I'm at my age, for instance, I'm 28 right now, and I probably walk into a clinic and then I want to get contraception, and the midwife will probably ask me, "Oh, like why don't you want to have kids?" And then the next thing is probably asking me for my age, and the moment she hears my age, "Oh, but you're old enough to have kids, so you probably shouldn't start doing this now." And then now they will go into like a whole rant of telling you the adverse effects that the pills will have on you, and not even highlight any of the positives. So sort of they are trying to talk you out of your decision to be on contraception. So I think the education should also go further than boys and girls, women and men, to also provider healthcare providers. And they should also have gender sensitive training, because we are different. Like no one, women are not beneath men, men are not above women, but we are so different. So how you approach giving reproductive care to a man is probably totally different from how you approach giving reproductive care to a woman. And even to be more inclusive, to a trans, to a non-binary person, it's totally different. So there should just be gender sensitive education for these people to know how to approach like people and their care based on the gender that this person presents, or based on this person not even wanting to present as any gender at all. I think is very important. And yes, back to sex education. I think for my background, it was there was none, honestly. To be very honest, there was none. And there was just this total and absolute fixation on the adolescent girl. So you just have so many people, like, even though there was no education, you just have so many people commenting on how my body is changing. I got that a lot because when I hit puberty, I just sprouted all over the place. So you just have so many people commenting on how your body is changing, and then men making very weird and perverse remarks about what they would want to do. Then you get maybe a couple of family members telling you that, okay, so at this age you get pregnant. That's what I started getting a lot. So all they kept telling me was, at this stage I can easily get pregnant, but there was no education. I had cousins who were my age, and I realized they were not getting any of this. Like, even though we were at the same age, we've all hit puberty, but nobody was make having these talks with them. They were telling me that if I have sex with a man at my age, I can get pregnant. But they were not telling these boys that at their age, if they have sex with a woman, the woman or girl can be pregnant. It was very centered on the adolescent girl. So the education should just be more comprehensive. Just not ignore the boy child, but um sort of have an education that targets the boy and the girl child together, so that we each know, just like you said, we both know, okay, what is going on with the other person, and they also know what is going on with us. And even with this, it's sort of like a grassroots solution, because then when they are growing, I'm not going to hear a man tell me that they don't want me around just because I'm on my period, because they do not know better, and that's totally okay. um yes, again, I have spoken a lot.
Right.
I'm going to leave the last so V, do you have anything else to add to
Yes.
this section?
We
Please go
see
ahead.
our great friend, colleague Isabel left us a comment in the chat that I think is also in line with what were discussing. And she said, what do you think are some effective ways one can combat body shaming in various environments, both physical and online? And I think that's a great point because body shaming also enters into like this gender norms area. People body shame
Mm-hmm.
because they think that your body isn't in line with what you should be, or you're not enough as a woman or a
Mm-hmm.
man, you know? I think with women, it depends on where you live. But for example, in Mexico, women should be taller. They should have a lighter skin tone. They can't be that dark, even though it's kind of ridiculous, you know. They should be voluptuous, but they should also be thin. And men should be tall. They should have a bunch of muscles. They should also have facial hair. They should have a bunch of things that, quite frankly, not everybody can have. You know, even if you go to the gym every day, like it's very hard to get a six pack. So they're just things that are out of our hands. How do we combat this? I think again, if we question the gender norms, then we understand it's not about us; it's about them. Like if somebody says your hair is not long enough, it's not about me. It's about why they think women should have long hair. If they're saying you're too skinny, again, it's not about me. It's about what they're thinking about in terms of gender norms. So remember that gender norms aren't a reflection of what's wrong or right with you. It's just a reflection of what society thinks. What do you think, Gil?
Things. Yes, I definitely agree with you. Sometimes people are just projecting, and for my part, I think it's sort of the other way around. So a woman is considered feminine when she's probably petite but also thick in all the right places. And they would prefer a man to be taller, to be muscular, facial hair, of course, because these are signs that, okay, yes, we accept you. Like, you look amazing by societal standards. You are the perfect man or the perfect woman. I think this also takes me back to our last session where we talk about body positivity and acceptance. So one of the ways in which you can sort of imbibe what Vianney just shared, that always remember that it's about them. Is like a reflection of society on them, and it has nothing to do with you. Is to also build your self-worth and your self-esteem up, because I feel like nobody can like body shame you if you think that you are that person. Like when you wake up every day, stand in front of the mirror and say, "Yes, I'm gorgeous. I'm so beautiful. I'm literally one of the prettiest persons ever." It's very difficult for like the things people say to, I don't know, rattle you very easily. I know sometimes it can get overwhelming, especially when you are getting it a lot, but affirm yourself. Affirm yourself every single day. Believe in yourself. And like Vianney said again, remember that it's societal expectations. You have no obligation to live up to them. You can just be yourself. Just exist, because you're amazing, like just the way you are. So yeah, that's what I have to add.
I love that. I love that message. You're so right. Just look at yourself in the mirror and be like, I'm gorgeous. And like you will understand that's their problem, not
Mm-hmm.
yours.
Right.
Mhm.
Okay. So I think at this point we are wrapping now. But Vianney, can you share with us? Um, I'm sure you did a little bit of research before the session, but what are some of the ways you found that at the societal level we can achieve a more gender inclusive care when it comes to reproductive health?
I think in general, we should see what kind of programs, for example, in the educational level, our schools have. Your school district, uh, your it depends on the country, but in your state, are you allowed to talk about gender equality? Are they have programs to talk about gender equality? I know that where I live, we have where I live, there are a lot of sexologists that give classes to kids according to their age. So they'll talk about age and gender norms, things regarding like how
That's
old they
so
are. So if
cool.
they're in elementary school, they'll talk to them on that level, secondary, preparatory, and college. Also, I know that where I live, contraception is free. If you're a student, you can get anything free: an IUD, a condom, the birth control pill, the implants, the injections. Everything's free as long as you are a student. So that's also good to go. If it's not, then I think as a society, we should go to any group that advocates for this. Look at the programs that allow this in your region, and also like if you're a student, go to your university and advocate for this. Say, I want this. No, if you are working, see what goes into your medical expenses. If these things are allowed, if there's like a policy regarding gender norms, if it's respectful to all gender identities, to all sexualities, to all ages, to all races. It's things like that that it seems impossible to change. But I think if we investigate and we see like what we have and what we can achieve, it's very helpful. It might take a while, but I don't think anything is impossible. But I just saw you say no, Gil, to the most of the things I said. So can you share your experience?
Yes, because no, I mean, I live in a country where people don't even want to talk about sex. They act as if it's not happening. Honestly, people don't want to talk about sex when you are so. I remember my sexual health and reproductive journey started because I used to do a lot of sex education on my Snapchat, a little bit on Instagram, and at that point I was honestly just having fun with it. I I saw a gap because I grew up in this society where there's literally like no sex education. I saw a gap and I wanted to help as many people as I could. I used to get so many negative messages, and it affected my relationships. So I mean, back then when I started, I was with a guy who told me that it's either him or my my passion, my newfound passion to do sex education. And it was hectic. People do not want to talk about sex here. I think somewhere 2022, 2023, they were trying to introduce these laws. It became a whole thing about sexual education. Parents got angry. A lot of parents got angry. They say they don't want their kids to start learning about sex at that age, and it's bad practice. And yeah, so no, I don't. Maybe the private schools, but I didn't attend the private school, so I can't speak for them. But in general, in Ghana, no, there's no sexual education going on in schools. Contraception is not free. So the only time I get free contraception is if I go for a concert or an event, and one of their sponsors or partners is one of the condom companies in the city. That's the only time you get free contraception. They'll come around sharing condoms, so you can pick as many as you want, but contraception is not free. It's actually quite on the high side. And to be very honest, with the cost of living and with how the economy of Ghana is, I can probably say more than half of Ghana's population, like when you take women, can probably not afford to have contraceptive options. It's I know there are some programs for um mothers, for people who already have kids, but for single women not wanting to start a family yet, I don't think contraception is easy to come by. So for me, if I was going to talk like in respect to my society, I would definitely say they should ensure there's access to contraceptive methods in almost every clinic. Like literally, I wish whichever hospital you enter, they will be available and ready to provide you with this service, and it should be free. At least the cheaper ones, it should be free. It's going to be very helpful for people. And yes, I think you said everything else, and this has been a very educative session. Do you have anything else to add, V?
Uh, I think what I would add is that like the first step is to understand gender norms, to understand what it is and like
Mhm.
which ones exist. Because maybe there's something that we thought that's normal and it's a gender norm, and it's like not necessarily something we need to follow or we need to choose to or like be forced to do. So that's my one thing. And the other thing is that we did talk a lot about the binary of like man and woman. So again, like anybody who is non-binary, who maybe is
Mhm.
gender fluid, you enter this conversation too. And I think they have a much better grasp at understanding like we can defy gender norms, that gender norms are something that should dictate how we live. So I also want to like shout out that community because I know they do a really great job combating these types of gender norms. But other than that, nothing. It was like a very, very great chat with you, Gil.
Yes, same here. And I hope everyone who gets to listen learns as much as I did, because I learned a lot from you, Vianney. Thank you so much for sharing your thoughts. And as always, Unapologetically Uterine is a partnership between Safe to Choose and How to Use Abortion Pill. How to Use is a digital platform where you can access accurate and reliable information on how to get the abortion pills, where to get them, especially in your country. We have country specific information on where to access care for abortion, post abortion services, what to do before, what to do after. We also have a video series that can take you through the whole process. And our chatbot Ali is always available on WhatsApp. You can find us on Instagram, on X, on Facebook, on Twitter, on TikTok, and on YouTube as How to Use Abortion Pill, or HTU Abortion Pill. So you can reach out to us whenever. Safe to choose. Where can you be found?
Yes, Safe to Choose is also a platform that provides abortion support information. We love Ali, the chatbot, and we on our side have the Safe to Choose counselors. So if you want to chat with a counselor, it's a free service. It's available anytime, any place, regardless of where you are, who you are. You will always be supported. We provide information on safe abortion with pills and safe in clinic abortions, and just in general, a lot of resources that I think are really, really great. You can find us on X, on Facebook, on Instagram, on TikTok, on YouTube, as at Safe to Choose. And if you are a Spanish speaker, you can find us as at Ayuda para Abortar. But yes, either of these platforms are really great, and you can use both of them. It really, if you want to like just compare information and get all the resources possible.
All right. Thank you guys. And thank you, Vianney. Thank you, everyone, for joining us. And until next time, bye.
Bye. Thank